Good afternoon, everyone. Welcome to the Cherokee County Health Department Board of Trustees meeting. It is May 28th, 2026, and it is 4:01, roughly. We're going to call this meeting to order. Please make sure that you shut your cell phones down or any other devices as we begin this. So I'm calling this meeting to order. Please rise for the Pledge of Allegiance. May we please have a roll call?
Mr. Pigg,
I am here.
Dr. Henry, Ms. Stidham,
Here.
Mr. Deal,
Here.
Ms. Taylor.
Here.
Ms. Henry is excused. She is on a seminar for her work at this time, so thank you for that. Ms. Stidham, would you please read the JCHC mission, vision, and purpose?
Yes. Mission, promote positive health outcomes through delivery of foundational public health services. The vision is a healthy Jefferson County. Purpose of the health center, RSMO 205050. JCHD is established, maintained, and operated for the improvement of health in all inhabitants of Jefferson County.
All right, thank you very much. Next is the approval of the agenda as presented, unless there is amendments to be made. I don't have any amendments. Do I have an approval for the agenda?
I motion to approve the agenda.
A second.
Having a first and second, is there any discussion on the matter? Not hearing so, all in favor, please say aye.
Aye.
Any opposed? Please say no. Motion carries. Next is the approval of the April 30th, 2026 meeting minutes. Do I have a motion, please?
I make a motion, we approve the April 30th, 2026 meeting minutes.
I'll second.
Having a first and second, is there any discussion on the matter? Not hearing any, all in favor, please say aye.
Aye.
Any opposed?
Abstain.
Abstain. Thank you. One abstention on that. Thank you. All right. Approval, next is the approval of the April 26th expenditures, $72,231.14. Do I have a motion?
I make a motion that we approve the April 2026 expenditures.
Do I have a second?
I'll second.
All right. Having a first, second, I do have some questions. CDW Government, Inc., the camera software, 5-year license, $14,000. Help me understand that one.
We did get our cameras all switched over to Meraki, so it's still part of the transition, but I'll let Steve explain it.
No.
And it goes to sleep, I know.
Did you unmute me?
There you are.
That's good.
Yeah, so we transitioned away from our Windstream services in our Arnold location. And in order to do that, we had to relicense all of the cameras up there because that was under our Windstream contract. So we actually, I can get the numbers more directly to you because I don't have them
Okay,
with me right at this moment.
so my
but-
next question is, why is there another $11,000 down further for camera license renewal?
So those are for this building as well. We only had a 1 year with Brock Miller, so we had to renew at some point. Otherwise, we wouldn't be capturing video.
It just seemed like a lot of dollars on camera licensures.
It is a business.
I know.
That's for sure.
All right. That was my questions. It just, like I said, it was like, boy, it looks like a lot, but I get it. Does
So-
anybody else have any? I'm sorry.
Arnold's for 5 years, and this is,
And we renewed
1
this
year?
for 5 years as well, just to stay within that same track.
oh, so it's 5 years also?
Yeah.
So 5 years, that makes,
Okay.
It makes it a little easier.
It was kind of
Thank
get
you.
everything onto one system rather than having multiple systems at both buildings and to operate.
Well, the
more
one does say
efficiently.
5 years, but the other does not have a time length on it, it just says renewal.
Gotcha, yeah, I can get that information.
No, it's fine.
so-
No, I'm not, I just,
We are totally, Windstream is totally done.
Correct, yeah, we are no longer within Windstream anymore in our Arnold location. We're actually managing that internally.
I'm happy with that. No, because that was always one of my concerns.
Yeah,
'cause
I'm sure.
I did see it on here, I guess like the 9,000, that was our last payment to them.
Correct, yeah.
Because then
we-
I didn't see it for the next month. I'm like, okay.
I think
so
for
we're
4
done.
months
Okay.
of this year, we had it, and then
I'm
the
happy with that.
remainder of the year, we're out from under the Windstream contract, so.
So then we won't have like a monthly bill then for these cameras? This is,
Nope, it's a 5-year license cost.
so we're
Now-
saving money if we were spending 10,000 on
Right.
Windstream
Well,
right
that's what-
now. Yeah.
Correct.
that was my first thing,
Yeah.
like, is that 11,000 a year?
Yeah,
My
it's
Lord.
definitely gonna save money.
Yeah, over 5 years, we will see
Give me heartburn.
an increase in savings.
All right,
Great
very
job.
good. Is there any other questions? So this is there's a motion and a second on the table for approval of the $72,231.14 for the April expenditures. No more questions? All in favor, please say aye.
Aye.
Any opposed? Motion carries. And thank you, Steve, for that
Thank you.
information. Next is approval of the 2026 electronic payments for $569,860.58. Do I have a motion?
I'll move to approve those expenditures in that amount.
I'll second.
Having a first and second, is there any discussion on the matter? Not hearing any, all in favor, please say aye.
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 Any opposed? Motion carries. Next is the pre-approval of the June 2026 electronic payments for $583,747.00. Do I have a motion, please?
I'll motion to approve.
I second.
Having a first and second, is there any discussion on the matter? Not hearing any, all in favor, please say aye. Aye.
Aye.
Any opposed? Motion carries. Mr. Sykes, Director's Report.
Okay, I'll just start out with some events that were attended in April. April 16th, we had the Jefferson County Drug Education Conference at the Civic Center. And Jillian Bissell, who is our public health outreach specialist, worked very hard. She puts this together, does most of the work putting this conference together. It was well attended. We had some topics such as Narcan training, emerging drug trends, which is always very interesting and scary. There was a panel discussion and a lot of other speakers that is over at the Civic Center. Also in April, we had our spring professional development day with our staff here in this room. Some of the things that we talked about, we tried to make HIPAA training exciting this year. Oh, I'm not talking into the mic. Do I got to start over? I'm kidding. Sorry about that. So we did a HIPAA training with called Hungry HIPAA. That was interesting. We did mandated reporting training. Christy came and did that for us. One thing that we do at each of these trainings is we have a program within our health department to have the employees come and do a day in the life. And so they talk with our other employees about what their job entails during the day. And this year was a day in the life of family planning and TB. Oh yeah, we had TB was also a day in the life. Sorry about that. And I want to thank Brianne. She works really hard on putting those trainings together. I attended a LPHA regional training for administrators. This is, I think they do 2 of these a year. They're mandatory as part of our incentive funding, and they just have a lot of various program updates from Department of Health and Senior Services that they give. Opioid Task Force, I sit on that committee for the county. This is the task force that was established as far as the opioid settlement funds that the county has. And we, at our last, I think it was 2 meetings ago, we established 3 committees from various subject matter experts in the county. 2 of our employees sit on 2 of the committees. And there are 17 members split into 3 categories of treatment, prevention, and then other opioid abatement strategies. So the vision here is that these committees, these subject matter experts will put together proposals and bring them to the task force. We will review those and we'll forward the ones that we feel like are the best options. We'll send those on to the county council for their approval. Hopefully, we'll see some movement on that in August, I believe, is when we're gonna meet again to see if there's any proposals ready yet. Another quick update, I attached a map. I think it made it into the packet. It's the Rural Health Transformation Funding, and I think we've already established, but I think it's 100% certain that we are not part of this funding. The map came out with all the regional hubs. This is, I've talked a little bit about this, and he finally released it. And if you look, you can see Jefferson County is shaded in gray, indicating we are not going to be part of the hubs or any of this, not directly.
Do we know what criteria they used?
For rural?
Was it strictly population?
I don't know that. I can look into it some more. I do know that at one of our meetings, someone mentioned that Representative Jason Smith did say that this money was very much intended for rural communities. So again, Jefferson County has always had that issue of we are very rural in areas, but they still look at us as not being rural. I don't know how that's gonna. Yeah.
Very aware.
So maybe indirectly we may see some good outcomes for this in our county, but as direct funding right now, it doesn't look that way. I want to mention as well is that we've activated our FEOC internally here. That's our Public Health Emergency Operations Center. It's just an internal level 1 awareness and planning. And the reason this has been activated is due to the several large-scale international events happening in Missouri this summer. And I listed those. FIFA, which that's really in the Kansas City area, but the whole state is on an awareness level because they feel like there'll be people in St. Louis and all around. So this is going to affect the whole state. And then, of course, the America 250 celebrations and Route 66 100th anniversary. These are large events happening in our county or our state this summer. Again, this is just an awareness, and we like to have a time stamp of when we start something in case there is a communicable disease outbreak or a terrorist act. We've already been in the process. I think Gina and Anne Marie are both involved with planning with the state and other counties right now on those. And then I want to mention real quickly, we are having another blood drive here at this facility on June 4th. It'll be from 1 to 6 p.m. And if you go to our website, you can register on the website as well. But that's June 4th, 1 to 6 p.m. And that's my report.
Thank you. Does anybody have any questions for Steve?
Steve, how much money's in that opioid task force?
Top of my head, I can't. I've got it written down, but I don't have it on top of my head to give that out. I don't recall.
So is all the money going to the county going to be distributed by the task force? Is that right?
Well, there's 2 funds, and we're doing one set of the money that has been put into this fund. We're doing that, and probably the other part of it we'll look at is also distributing it. But again, the task force will not be actually giving out the funds. We are just reviewing it to submit to the county council, and then they will do the approval.
Those are recommendations
Yeah,
to them?
yeah.
Okay.
Yeah,
On the hub regions, was it DSS that established the regions, the hub regions,
Yeah.
or federal?
no, it was the
Agencies.
state, DHS, yeah, DSS, yeah.
Hmm.
But they worked with Department of Health and Senior Services and some other agencies within the state to set up these regions. I don't know the criteria. I know there are some, that we were on a meeting about this. There were some counties kind of wondering why they split. There's one area up in the northern part of the state where it's a tri-county. They're all involved with one health department, but they
Mhm.
split them into different hubs. So they're wondering, they may
Why,
redo
yeah.
that, but, so, I don't know the reasoning of how they split it.
'Cause they just like threw us in with St. Louis and St. Louis County, which are bigger regions, more urban rather than rural, so.
Well, they're out of it. They didn't get,
Yeah, but they
part of it.
put us in with them, which we're not urban, basically.
Yeah.
Well, in my mind, we're not urban, but obviously in their minds, we are.
yeah.
Thank you.
All right, any other questions for Steve? Does anybody have any questions about the programs that were presented inside your packet? All right, not hearing any, we're going to continue on. Next is public comments. I don't believe there's anybody here for public comments. Thank you. There is no old business, I guess they're kind of old business. New business is the second reading and approval of the resolution of Jefferson County. I'm going to have to make an amendment to this resolution. It should be a simple amendment. I'll need a first and second on it. But the amendment is going to be removing the signature line of the vice president on, vice chair, excuse me. Ooh, went right to the place that didn't need to go. The vice chair, we don't need that. It's an unnecessary signature line. So if I can have a motion to remove that.
I make a motion to remove the vice chair signature line.
I'll second.
So we have a first and second. Is there any discussion on the matter? Not hearing any. Roll call, please.
Mr. Pig?
Yes.
Dr. Henry? Ms. Stidham?
Yes.
Mr. Deal?
Yes.
Ms. Taylor?
Yes.
I'll entertain a motion to now make a second reading of the Jefferson County Health Center resolution on disclosure of conflicts of interest. Do I have a first?
So I move to approve the second reading of the amended
Thank you.
resolution.
I second that.
Having a first and second, is there any discussion on the matter? Not hearing any, I will now read a portion. Jefferson County Health Center resolution regarding the disclosure of conflicts of interest pursuant to section 105.485 RSMO, and the resolution number would be, please.
26-05-28-01.
Thank you. And whereas public officials and employees must be independent, impartial, and responsible to the people in order to effectuate the proper operation of Jefferson County Health Center, JCHD. Any questions on the reading?
Is that the final reading?
It is the final reading, second and final. Not hearing any questions on the matter, roll call,
Mr. Pig?
yes.
Dr. Henry? Ms. Stidham?
Yes.
Mr. Deal?
Yes.
Ms. Taylor?
Yes.
The resolution is passed. Next is CD and FDA updates. Steve, do you have anything?
I don't have anything on that today.
All right. Is any of the board members, is there anything on anybody's plate that they know of and have? All right. And next is entertaining any topics anybody'd like next month. Is there any topics? Besides normal stuff, all right. Not hearing any, do we have a need for closed session? Oh, here we go. All right. We need a motion to go into closed session, please.
Make a motion.
Go ahead.
I make a motion, we go into closed session.
Second.
Having a first and second, and this would be pursuant to 610.021 Any confidential or privileged communication between the Board of Trustees of the Jefferson County Health Department or its representatives and its attorneys, and records which are protected from disclosure by law. Is there any discussion on the matter? Not hearing any, roll call, please.
Mr. Pig?
Yes.
Dr. Henry? Ms. Stidham?
Yes.
Mr. Deal?
Yes.
Ms. Taylor?
Yes.
Counselor, will we need to come back and disclose it? So we will not have, there will be nothing to report out after the meeting, after the